Okay, well, let's see. Maybe some people might still join afterwards. So, hello everyone. Thank you again for joining the Dementia Open Forum, or hello if you're here the first time. This is a series we're running on a bi-monthly basis to essentially allow for people to disseminate their findings to a broad audience of clinicians or healthcare people, social care people, researchers and carers and people with dementia. So it's my great pleasure today to have Smruti Bulsari with us. Smruti is a senior research officer at the Institute for Public Health and Wellbeing at the University of Essex. And Smruti does fantastic work, so I thought it would be brilliant to hear from her what she's going to tell us. No pressure, Smruti. So if I could ask you to start sharing your screen, Smruti, please. And if you have any questions in the audience, you can either type them in the chat already during the talk, but after the talk, I will go through the chat, but or you can come online and ask your question in person. Again, pleasure to have you, Smruti, and over to you.
Thank you, Michael. I hope you all can see the screen.
Yes, thank you.
Thank you so much. So my work has been on a couple of areas in dementia, including dementia strategies. So my background is basically in economics and public policy. So I am more of a policy analyst, and that is what I have tried to do for my research. So I'm going to give a kind of non-technical talk. I don't think I'm talking anything about the research methodology or the analysis techniques or anything, but broadly what has come out of my work, plus something related to Norfolk, since the event is happening at University of East Anglia. I thought of considering Norfolk's dementia strategy as well, which is originally not a part of my research. So my topic is dementia strategies and how are these dementia strategies relevant to people living with dementia, and not only people living with dementia, but also for their carers and people like us. So this research is supported by NIHR. This is the disclaimer, and whatever I speak today is entirely my own views. NIHR doesn't necessarily support these views. So this is what I'm supposed to say. And I also thank NIHR for supporting my research. So what I'm going to talk today is about who dementia strategies matter to, why are dementia strategies required, and then my work has been on dementia strategies of England. Of course, my work is a lot broader than dementia strategies of England, but my focus today would be dementia strategies of England. Then we will focus on the need for regional dementia strategies, and I would touch upon the dementia strategies of Southend, Essex, and Thurrock, which is a part of my research work. And as I said, not a part of my research work, but I would also touch upon the dementia strategy of Norfolk. And finally, as a citizen, as an individual, as a person living with dementia, or as a carer of person living with dementia, how can I make my voice heard in the development of dementia strategies? So this is what I'm planning to talk about. So why do we need dementia strategies, or why do dementia strategies matter? To whom dementia strategies matter to? So we can see that there is a huge, number of persons. There's a large number of persons living with dementia. And as of now, it's 1 million, and it has been projected that it will rise to 1.4 million by 2040. And if you are living in England, I don't know much about Scotland, Wales, and Northern Ireland, but if you're living in England, I'm quite sure that someone in our family or extended family is, we at least know one person who is diagnosed with dementia and living with dementia. So I think it affects us, all of us. The total cost associated with dementia is also very high and is expected to even increase by 2040. I'm not going into details of the figures, but 65% of this total costs are borne by the individuals and their families. And these are costs that can be seen, costs that cannot be seen. People have to reduce their working hours, or people have to leave their jobs because of the condition or because of caring for a person, a loved one with dementia. And an individual with dementia spends on an average 100,000 on social care over the entire lifetime. And given that there is no cure for dementia strategies do matter to all of us, each one of us. So why are dementia strategies required? Now, what basically are strategies? So strategies are basically some sort of plans. They are different from policies, they are different from action plans, but they come with, identifying targets, allocating priorities. So they come with the explanation of why these are the priorities and which are the priorities, which of course is better if it is backed up by an action plan so that the implementation can be tracked and whatever goals that have been set out in the strategy could be monitored. Dementia strategies gives a vision to the policymakers, of course, and a direction to tackle the priorities, and it helps in reducing inequalities. We will soon see more details about inequalities as we talk about the regional plans, regional strategies. And dementia strategies brings together all the stakeholders. And when I say all the stakeholders, it also includes people living with dementia and their carers. And we will soon see towards the end of my presentation about how people living with dementia and their carers can also contribute to dementia strategies. Coming to the framework of dementia strategies. So in 2014, Alzheimer's Europe launched the Glasgow Declaration, and it was unanimously accepted or adopted by the delegates. In 2014, there were 26 member organizations that were a part of Alzheimer's Europe. Currently, there are 41 member organizations in 36 countries across the Europe, which are associated with Alzheimer's Europe, and a lot of these countries already have their own national dementia strategy. So what is this Alzheimer's Europe? Alzheimer's Europe is a non-profit, non-government organization that brings together national Alzheimer's associations across Europe, and it is based in Luxembourg. So, Glasgow Declaration calls for developing an overarching dementia strategy for the whole of Europe. Of course, the overarching dementia strategy of Europe, I have not analyzed for my research, but I did analyze the dementia strategies of a couple of European countries and compared it with England's dementia strategy in the background of Glasgow Declaration. The fundamental rights that are laid down by the Glasgow Declaration, I'll come to it in the next slide. Glasgow Declaration further calls for developing a national dementia strategy for each country, recognizing dementia as a public health priority, and developing an action plan on dementia. So the fundamental rights laid down in Glasgow Declaration, which are supposed to be incorporated in dementia strategies, the national dementia strategies of the countries of Europe, are the right to timely diagnosis, the right to access to post-diagnostic support, person-centered and coordinated care, equitable access to treatment and therapeutic interventions, and most importantly, respect as an individual in the community. Now, apart from Glasgow Declaration, WHO in 2017 launched a global action plan on dementia. And the global action plan laid down 7 key action areas. And the key action areas are, again, dementia should be recognized as a public health priority. There should be awareness about dementia and taking dementia-friendly activities. I can see that Norfolk has done a very good work in developing dementia-friendly, I'm sorry, it's England's dementia strategy, but I think Norfolk has done a good job as well in adopting this dementia-friendly initiatives. Reducing the risk of dementia incidents, which is also quite important because dementia doesn't have a known cure, and it's best to stop rather than to tackle once it is diagnosed. Of course, timely diagnosis, support, treatment, and care, providing necessary support and training to the caregivers of people living with dementia. This is also very important because I have been interacting with people living with dementia and their carers recently, again for my research, and I understand that not everyone has an absolute clarity on how to take care of their loved ones. Especially I'm talking to the family carers. So one of the examples, one of the incidents I came across was, we have not told that you are having dementia. And it was a bit of a surprise, plus I'm not sure whether it is okay to not let the person know that the person is living with dementia. Does the person really not know that they are living with dementia? So it's really important that the carers know what should be done in this situation. Develop a core set of dementia indicators and collect data on those indicators every 2 years, which can be very helpful to researchers like us to come up with different analysis and identify the patterns, which can again be fed into the national dementia strategies and also into the regional dementia strategies. And then, of course, undertaking research and coming up with innovation. So these are the key action areas laid down by WHO's Global Action Plan, which was implemented in 2017. Now we come to Dementia Strategies of England. I would like to remind you that the Glasgow Declaration was signed in 2014. WHO's Global Action Plan came in 2017, but England had its first national dementia strategy in 2009, implemented by the coalition government in 2010. The second dementia strategy, of course, was revised. The dementia strategy was revised, and it was called the Prime Minister's Challenge to Dementia. It was revised in 2015, but implemented in 2020. It was implemented in 2015 with the targets to be achieved by 2020. And, oh, I missed the middle one. There was another one in 2012 developed by the coalition government with the targets to be achieved by 2015. This was also prior to the Glasgow Declaration and the WHO's Global Action Plan. So England was really, proactive in terms of coming up with the National Dementia Strategy. And we all know that the situation of dementia in England is really worrisome. So it is really the need of the hour. And 2009 was really the time when, the focus should have been given on how to tackle dementia. But unfortunately, we will, 2009, 12, and 15, I have not touched upon in this presentation, but I would like to tell you that initial dementia strategies focused only on care, whereas the recent dementia strategy also focuses on people living with dementia, the carers, and of course, on the prevention and research. Okay, so not going into the details or not reading out the timelines on the slides, but coming to the Prime Minister's Challenge of Dementia 2020. Well, you might have noted over here that in 2022, a 10-year action plan was proposed by the Conservative government, but it is not yet released. So I'm discussing the last publicly available document, which is the Prime Minister's Challenge on Dementia 2020. And as you can see, the focus is on support, research, staff, service, care, carers, people, inclusion, work, community. Now, this word cloud has been developed from the words picked up from the Prime Minister's Challenge on Dementia 2020. This is an output of one of the outputs of my ongoing research, though this is just for the demonstration purpose. A lot more analysis has been undertaken to understand the core areas of the Prime Minister's Challenge on Dementia 2020. So the focus areas of Prime Minister's Challenge on Dementia 2020 is improved public awareness and understanding the factors which increases the risk of developing dementia. One of my ongoing works I'm co-producing with Essex County Council, and this is what we are exactly focusing on, the risk of identifying the factors which increase the risk of developing dementia, and then, working out interventions to reduce the risk of dementia. The second focus area is people with dementia having equal access to diagnosis as for the other conditions. Of course, this is a very, this is necessary, but if we talk about access to diagnosis for other conditions, then too, we all know that NHS is really understaffed and the diagnosis of other conditions are also taking a lot longer than it should. So apart from dementia, diagnosis for all the conditions should be, prioritized, and the time should be reduced. Every person diagnosed with dementia having meaningful care following their diagnosis in accordance with the published NICE quality standards. All NHS staff having received training on dementia appropriate to their role. All hospitals and care homes meeting agreed criteria to becoming dementia friendly and care setting. This is what I had been referring to when I mentioned about the key action areas of the Global Action Plan of WHO. The Prime Minister's Challenge on Dementia 2020, which was actually implemented in 2015, before the WHO's Global Action Plan, also has included dementia-friendly initiatives, not only in hospital and care homes, but also in the geographical regions, which is areas which I have termed as areas, in businesses, public sector organizations, and all these places are required to be dementia-friendly according to the Prime Minister's Challenge on Dementia. Funding for dementia research on track to be doubled by 2025. We are already in 2025. I cannot say with certainty whether the funding has been doubled or not, but I have seen recently a lot of emphasis is being made on the research related to all aspects associated with dementia, and a lot of funding has come in for dementia research in past couple of years. An International Dementia Institute to be established in England. So in 2017, this UK Dementia Research Institute was established. And currently there are some 700 researchers from across the world working together under the under this institute, I mean, within this institute, we come to the regional dementia strategies and why do we need regional dementia strategies? So each region has its different characteristic. And if we talk about the levels of deprivation, we talk about equality in access to services, equality in diagnosis, but there has been a stark inequality in diagnosis. One of my ongoing research reveals that. And the levels of deprivation is also, it varies across different LSOAs and upper tier, even lower, middle, and upper super output areas. But if we talk about Norfolk as a county, it is ranked 84th most deprived out of 151 upper tier authorities. And of all the lower level super output areas, this lower layer super output area, or the LSOA as it is called, earlier used to be wards. And now they are some sorts of, it's a concept of neighborhood, which is not just one single ward, but a combination of nearby small areas, which typically contains between 1,000 to 3,000 people with an average of around 650 households. So considering the lower layer super output area, 5.95% of the LSOA in Norfolk fall in the 10% most deprived areas. 5.2, of course, 5.2 of the least deprived areas are also in Norfolk. Conversely, in Essex, of course, is deprived, but when I was going through the statistics of Norfolk vis-a-vis Essex is relatively less deprived compared to Norfolk. That is what I found. So conversely, in Norfolk, 8.6% of LSOAs are in 20% most deprived decile. So this requires the upper tier regional dementia strategies to be developed, and the lower layer and preferably LSOA level approaches should be incorporated in the dementia strategies developed at the upper tier regions. So inequalities could manifest in terms of geography, the region where you are living. It could be economic inequalities. It could be demographic inequalities. Demographic inequalities in terms of more retired people living in a particular area. So I'm currently based in Colchester, Essex, and there are certain areas in the neighboring district, Tendring, where you will find a very high proportion of people who are 60 plus. So this could be demographic inequalities across the regions, and this geographical inequalities, economic inequalities, and demographic inequalities combine together to generate inequalities in access to healthcare. This is over and above availability in access to healthcare. Inequalities in availability to healthcare, this geographical, economic, and demographic inequalities add to the access inequalities. Now we talk about the dementia strategy of Southend, Essex, and Thurrock. Southend, Essex, and Thurrock, also called Greater Essex or the SET region, and therefore they have a combined dementia strategy. They are similar in a lot of aspects, plus being Greater Essex. This is a combined dementia strategy of Southend, Essex, and Thurrock. And the dementia strategy prioritizes prevention, supporting unpaid carers, reducing the risk of crisis, and having a knowledgeable and skilled workforce. This apparently sounds really, really broad. And if you look into the strategy, you will really feel that there is a need for action plan. How will the strategy be implemented for prevention? How the strategy would focus on supporting? What exactly would be supporting unpaid carer mean? What is meant by crisis and how the strategy is focusing on reducing the risk of crisis? And what kind of knowledgeable and skilled workforce in which areas? Of course, when we say knowledgeable and skilled workforce, it could range from NHS organizations to care organizations to everywhere. But the first three priorities need to be really clarified. Of course, as I mentioned earlier as well, that I'm co-producing this research associated with identifying the risk factors and then planning the interventions. I'm co-producing it with Essex County Council. So I, as an individual researcher, know that how they are thinking about working on prevention, but it still needs to be, thoroughly highlighted in the strategy so that people like us, I mean, forget for a moment that I'm a researcher, but yeah, even lay people or researchers or people living with dementia want to contribute, then they at least have an idea about what is meant by prevention, what steps are they planning to take for prevention, how are they planning to support unpaid carers, what are the issues faced by unpaid carers, what kind of steps are they planning to take for unpaid carers in under the supporting umbrella. And of course, the risk and crisis and everything. Despite the dementia strategy of SET focuses on reducing demographic inequalities because Greater Essex area has a higher population 65 plus as compared to the national average of 18%. Nationally, there are 18% people living 65 years, sorry. In England, there are 18% of people who are above 65 years of age as compared to 22% who are above 65 years of age in Essex. And secondly, they are focusing, the dementia strategy is focusing on economic inequality, especially deprivation through, focusing on this reduction of crisis and making available the knowledgeable and skilled workforce. Now we come to Norfolk, Dementia Strategy of Norfolk. So this is developed by Norfolk County Council and Norfolk and Norwich University Hospitals together. It is published by Norfolk and Norwich University Hospitals. This is also for 5 years from 2021 to 26, and it highlights 5 rights and 7 goals. So the 5 rights, out of 5 rights, 4 rights are of carers. The right to be identified, the right to be recognized as who they are, whatever they are, and not to be labeled, that, okay, this is a person living with dementia, is different. No, they are not different. They are just like us. They just have a condition. So they have the right to be recognized as what they are and being accepted with their conditions as they are. Yeah, that comes under community, of course, the right to continue with day-to-day and family life without discrimination. Yeah, so I talk more about community and identity, but yeah, identifying that, okay, this is a person who is living with dementia, and then despite the person living with dementia, that person should be just one among us and should not live any kind of different or secluded life. The third right is about the right to get cared properly. So right to an early and accurate diagnosis, and then to receive evidence-based, appropriate, compassionate, properly funded care and treatment from trained people. And when we say trained people over here, trained people also means the family carers undergoing training, not only the social care staff, but even family carers receiving whatever training that they are required to, that we will see in the carers right as well. And the right to participate in the research. They have the right to know about and decide what research they want to be involved into, whether they want to get involved into the research or not. And then once they decide that they want to be a part of the research, all the support to participate in the research. So these are 4 basic fundamental rights of people living with dementia. And the 5th is the carer's right. The right to be respected as partners in care and to be provided with education, support, and services, training, whatever support they require, including services in terms of what I understand is respite care. Because a lot of time, people who are caring 24/7, who are family carers, they really need a break to come back rejuvenated and take care with all the, all the energy and all the freshness of mind after taking a break. Recently, as I mentioned, I have been talking with people living with dementia and their carers. And of course, we are also reviewing the literature, and one very interesting point was raised in one of the literatures on carers, that yes, respite care is very, very essential. And carers, when they are away from their responsibilities, when the respite care replaces the regular carers, of course, on one hand, they rejuvenate, they come back fresh, but while they are not caring, they also feel a kind of guilt. So these things that have to be taken care of. That support also should be a part of the carer's right. Then coming to 7 goals. Skilled workforce. This is mainly in the context of the hospitals. So I remind you again that this dementia strategy is published by Norfolk and Norwich University Hospitals. And therefore, if you see these 7 goals, they are largely in the context of the hospitals. So the first goal is about providing training, staff training, and providing specialized services. The second is about treating people living with dementia and their carers as partners in care, working alongside the GPs, community services, and promoting awareness about dementia. The third goal is to have comprehensive assessments of the needs of person living with dementia, PLWD. I have put the short form, but it is person living with dementia, people living with dementia, and their carers, and referring for dementia assessment. Sometimes, or rather most of the times, it happens that once a person thinks that I need to go for an assessment, they go to the memory clinic, and from the time of memory clinic to the GPs, a lot of time has already been elapsed. So earlier assessment is important, but at the same time, reducing the time frame from assessment to referring to the GP and getting a proper diagnosis is also, I mean, this is over and above assessments I'm mentioning. The strategy already mentions about assessments, and then the decisions about the assessments be supported through the Mental Capacity Act. Coming to the person-centered care. One of the goals is to provide person-centered care, and person-centered care is different from individual care, but it is important to take care of both the person-centered care as well as individual care. So if I give an example of person-centered care, there are people living with dementia who doesn't only have dementia, they also have other comorbidities. Some of them are diabetic. So diabetes pre-existed the diagnosis of dementia. So they would need, as a persons, people with diabetes and dementia would need a specific type of care. But again, as a person, when we talk about a person who is maybe because of the age or because of ethnicity or because of religion, they might have different individual needs. So this is what I was trying to talk about, person-centered care and individual care. So making staff aware about the person's condition, whether there are any other comorbidities or not, and ensuring that the personal needs are also met over and above the person-centered care, and smooth transition of services upon discharge from the hospital. Making volunteers available. I already mentioned earlier about the shortage of NHS staff. So volunteer support also is a very important aspect and should be focused on, which Norfolk Dementia Strategies focuses on. Providing comfortable and supportive environment. The person should feel supported, cared for, and comfortable. The person living with dementia should not feel apprehensive about anything, because dementia invariably triggers anxiety. Any neurodegenerative conditions have that tendency of triggering anxiety. So environment is important as well. And then, of course, research. These days, all the dementia strategies, sorry, I would not say all the dementia strategies, but a lot of recent dementia strategies have started including research in their goals, in their key focus areas. And similarly, Norfolk also focuses on regional, national, international collaborations with an opportunity for people living with dementia to participate. And then finally, about the governance, where dementia-friendly care with continuous improvement is focused upon. Coming to how can I make my voice heard in the development of dementia strategies? So there are channels for communicating your voice. NHS England holds public consultations on a regular basis. There are engagement events which are organized by Department of Health and Social Care in partnership with charities like Dementia UK, Alzheimer's Research UK, and Alzheimer's Society. Moreover, these charities, they are also organizing their own events, or you as a citizen can just write to your council. You as a citizen can write to any of these organizations, any of these charities, and just an email would also just make yourself heard. Whenever you feel like you have something to say, just say it. And if you want to know about where you will get the information about these organizations, or about this public consultations or engagement events or workshops, then these events are announced from time to time. Their websites are updated about these events. The best thing is to stay connected with the charities. They have their local chapters, so just be a part of that, go there regularly, and you would come to know about the local regional consultation events by being a part of the charity. And you can be you can just go and participate in those events. There could even be online consultations. You can participate online as well. And you can also participate in academic research. Normally, what I know about is that the researchers approach the organizations or people, or they approach through NHS or any other organizations, and then the posters are put at different places. You come to know about the research and then you can contact the researchers. But recently in my ongoing research, where I'm contacting people living with dementia and their carers, it even happened that somebody found my email address and came to me and said that I want to be a part of your research. So do not hesitate, be a part of any academic research. You feel like whatever is the source of information, just make sure that it is authentic and you can approach. So this is how you can make your voice heard in dementia strategies. Dementia strategy, I like this initiative of South and Essex and Thurrock, that when this dementia strategy was being developed, there were online consultations and you could just put in whatever you want to contribute to the dementia strategies through this online link, which is currently closed because the dementia strategy is the period is almost coming to an end. So thank you for listening and questions. And these are my contact details. Feel free to contact. Thank you.
Thank you very much, Smruti. That was great. Give a great overview of dementia strategies.
Thank you.
If anybody has a question, please, well, either type your question into the chat or come online with the hand raised, or just put on your camera if you want to. So maybe I kick us off before people are still, considering this. So well, maybe ask you a difficult question to get you going, Smruti.
I'll answer if I have.
So what I always struck in, do we need all these regional dementia strategies, or is it not just good to have an overall dementia strategy? Are they not just replicating lots of things, or what's really specific for that region?
Your observation is right, that yes, a lot of regional dementia strategies, they just replicate whatever is there in the national in, different words and in different formats. But very recently, I don't know much about it. I'm attending an event on 21st of this month in Hertfordshire, in Stevenage. And Hertfordshire County Council has undertaken a very nice initiative of involving people living with dementia and taking their voices in developing the recent dementia strategy. And one of my research colleagues was a part of their entire research. So I'm just looking forward how Hertfordshire County Council's dementia strategy is different since they have adopted a completely different approach. But answering your question, that regional dementia strategies are essential because each region is different. But if the regional dementia strategies are just a replication of the national dementia strategy, it just doesn't serve the purpose.
Yes, yeah, I agree. That is the challenge, isn't it?
Yeah, that's a challenge.
Yeah. That will be really interesting, because you can see clearly each region has their own challenges, as you say. But if it's not reflected in the strategy, then then you can question whether, why do we need it? Do you know how many actually carers and people with dementia are aware of those dementia strategies? Or are they really meant more for the policy makers?
Yeah, this is a very good question. And while initially I was preparing for this talk, I had thought that I would mention right in the beginning, but somehow I missed out. And thanks you asked this question. I spoke at two different not dementia gatherings, but one of it was a community gathering where they wanted to hear about what research I'm doing. And the moment I said, it was a face-to-face talk, and I just said that how many of you have heard about dementia strategies? So raise your hand, and all of them were nodding their heads rather than raising hands. So 0% in one such one such community gathering, which was around 35 people. And they all said that we know somebody who is either our friend is diagnosed with dementia, or our distant relative is diagnosed with dementia, or my sister is diagnosed with dementia, but they don't know that there is dementia strategy. Yeah. And another place which I have been regularly going since past couple of weeks for participant recruitment, and there too, I don't think many people are knowing about. There are few people living with dementia who are attending that, they call it friendly cafe. So most of them are 60 plus, and some of them are diagnosed with dementia. Some are even carers who come to that gathering, but no, I haven't come across anyone who knew that there are dementia strategies.
Interesting, isn't it? Yeah.
Yeah.
Maybe it's more meant for policy, as I said. But the question is whether actually, if people would be aware, they could lobby more for what's already in the strategy. You know, they say, "You promised this. Have you delivered this?"
Exactly.
Anyway,
so when you approached about this talk, I was like, yes, I should be doing something to make people aware that this kind of thing also exists and we can contribute.
Well, you've done that today, so that's great already.
Thank you.
So we have some comments in the chat. Susan says, in Suffolk, carer and people living with dementia voices were also incorporated in formulating the Suffolk dementia strategy. Great question on whether we should all have our strategies. I think it helps with raising awareness locally. Yeah, I guess we would agree with that. Roz is saying, agree, individual strategies, but best practice should be shared. Does this happen? What do you think, Smruti?
I don't think. No, the best practices, I don't think. The awareness is so low that sharing the best practices comes only when there is an awareness that there are dementia strategies and there are some, changes in practices, and, but the awareness is not there, so sharing is not there. But if you talk about sharing at the policymakers level, I really don't know whether there is any sharing at that level.
Interesting. And then Anne Smith too, I said people with dementia and carers should have been consulted to contribute to the strategy, but few probably see the results. So do they see then the end? Maybe I could ask it differently. For example, for the national strategy, did they do some consultation or co-production? Are you aware of that?
No, I'm not aware of any co-production work at national level so far.
Well, that's a really good point then. That's exactly.
Yeah.
And then Russell is saying in Sheringham, North Norfolk, we're having an event hopefully this month for anyone affected by dementia, where we're going to ask this specific question about dementia strategies and pathways, how they receive support, and that these strategies should be addressing support for people in their community. So that's great to know, Russell. I don't know if you want to connect with Smruti. She can maybe advise as well. Sorry, I'm not giving you a job here, Smruti, but
no worries. I have shared my email address, and if you missed it, I can put it in the chat again, or you can ask Michael or Dan to get.
Yes, we're very happy to distribute that. And then Susan is saying again, SOAPs are doing their part in raising awareness. In Corrie, there's a current storyline on vascular dementia, which is an interesting point.
Yes.
What do you think, Smruti?
Yes, they do raise some kind of awareness. I have heard that some people know, but the memory retention is about the SOAPs and, the storyline. People remember the storyline, but then they forget the underlying message. That is what I have experienced, because I think I had not even heard about Alzheimer's I was quite young then, and we had one film. I was in India at that time, and there was a film which highlighted what happens when Alzheimer's is diagnosed, how Alzheimer's is diagnosed, and how people with Alzheimer's, what kind of problems are faced by them, and so on. It was a beautiful, storyline, but it was all forgotten until I came back to the dementia research and I recalled, oh, way back in early 2000s, there was this movie. So yeah, this is good. I mean, it is still doing its part, even if for a short term, it still is good that at least some efforts are being done to raise awareness.
Yeah, I agree.
But I'm really, I mean, fascinated to see this because, vascular dementia is very, very specific. And in Corrie, there is a story, I don't know what is Corrie, but
I think it's Coronation Street, the Coronation, yeah. So that's
but it would be really interesting to.
Right, but there you go, we're missing out. And Susan's also saying globally, Zimbabwe has awareness of the needs to diagnose early and support people living with dementia. And Alzheimer International, of course, is very active in this space.
Yes.
Who do a lot of the international work in different countries. And I think they were also involved in the WHO strategy, action plan, WHO.
Yeah.
There you go.
EastEnders.
Yeah,
yeah.
I can see who is into soaps, Susan. Brilliant. Do we have any other questions for Smruti? Well, okay, so before we leave, I just want Dan, if you could put our link again for our website, and so you can find information for the next one. The next one, yeah, that's what he just put there, is on Thursday, the 26th of June at 2 p.m. again. And there will be Martin Patel will be talking about assistive technologies in dementia. And so all that's left is to say thank you again for Smruti. Thank you so much for coming and talking to us today.
Pleasure is all mine. And thank you, Michael. Thank you, Dan. And thank you all the attendees.
Fantastic. And okay, well, hopefully see you the next time then. Bye.
See you. Bye.